let's talk about how to maximize your absorption of vitamin D because vitamin D is so important to your health. I want to make sure that you have all the details and the tips and tools that you need to get the most out of your D. Is that fair? All right. This video is for you if you are a woman over 40. I am Robin-Nutritionist. I've been doing this for 16 years, and I help women over 40 meet their nutrition needs and mitigate symptoms and concerns related to the pause, perimenopause, menopause, and beyond. And I am in the pause with you. All right, vitamin D is critical to your health. Some of the benefits include, but not limited to, there's so many, but it helps our immune system. It helps support normal, healthy insulin secretion. It helps normal cell growth, strengthens our teeth and our bones, influential in strengthening our muscles, improves hormone function, and can help with depression, anxiety, and mood. This is a key supplement for us over 40. It is estimated that 40% of the population is deficient, but if you are Black, so you have melanated skin, that number nearly doubles. So 76% of melanated folks are deficient. And then if you are over 40, the likelihood of you being deficient even is greater. Symptoms that you're really low include mood changes, being tired, muscle weaknesses, hair loss, bone pain, and a weakened immune system. Don't get caught without your vitamin D. I recommend that you get it checked. When you are going to get your yearly physical, don't get out of there without making sure that you have your levels checked. And I'm going to tell you what your levels should be. I think I have a slide in here for that. But the best ways to get your vitamin D: sunlight, supplementation, and you can get it from food, but I tell you that food doesn't move the needle as much. You can eat egg yolks and salmon, swordfish, and all of those things, but it doesn't really raise your vitamin D like the sun does, to which we're not often in. And then supplementation. So supplementation is usually where we need to go in order to make sure that we're solid with our levels. And I said this, it is a key supplement for us in the pause. All right, let's talk about how to maximize your absorption. This is important. Some of y'all don't know this. You want to take it with a fat source. So if you're taking the soft gels, then there's usually a carrier oil in there. If you are taking like D3 with K2, which I recommend, then I'm going to say take it with fat. So eat it or take it with food. Maybe you're having food that has avocado in it or salmon. In your food is a fat source. So take your vitamin D3, K2 with food. Fat is important to get it to absorb in your body better. If you're going in the sun, which is where it is abundant, then you want to spend at least 15 minutes in the sun without sunscreen. You're melanated, you even need more than 15 minutes. The point is you're out there without sunscreen. To maximize your absorption, magnesium is needed. Now you can eat foods such as leafy greens, pumpkin seeds, salmon, almonds, dark chocolate, which I just had a piece of, or you can supplement with magnesium. But magnesium is needed to activate the vitamin D and make it better absorbed. The other nutrients and minerals needed to help vitamin D behave would be zinc, vitamin A, omegas, and boron. These foods you can get, or these nutrients, you can get these vitamins, minerals, and nutrients you can get from fruits and vegetables. So we are needing to load up our plates on a regular with plant foods, and you can cover that there. So the better we eat, the better our absorption will be. If this information is resonating with you, and I have some more tips to share with you, please do hit the thumbs up. That's the like button, and subscribe to the channel. I always am sharing information that I believe is powerful for us as women over 40. And then I do videos that you ask me to. So if there's information that you have questions about, be sure to leave those questions in the comments and I will do my best to respond to you. But in the meantime, make sure to hit the like button and subscribe to our channel. All right, I talked about K2. You need K2 to help calcium. So listen, there's calcium that's in our blood from food. We need that calcium to go into our bones. That vitamin K2 works with the D3 to help all of that do its job. So to maximize absorption and maximize the effectiveness of your vitamin D, you want to include K2 with your supplement. You would not take K2 if you're on kidney dialysis or you're on blood thinning medication, because it may interfere with some things that you're doing. So you want to check with your physician on that. But otherwise, you're going to take your D3 with K2. And yes, I'm putting the necessary nutrition information here, and it'll be in the link below as well. Other things that rob you or block your absorption include statins, so that's cholesterol medication, stress, digestive and bowel disorders such as Crohn's, celiac, colitis, that impedes our absorption. So if you have digestive issues, then it may be true that you actually need to take even more. Going back to stress, it's easier said than done to work on that, but it's something that we got to work on because it'll do us in otherwise. And then your statins, your cholesterol medication, which sidebar, as we get older and our estrogen declines, our cholesterol has a tendency to go up, and the doctors are going to want to try to put you on statins. That isn't necessarily the answer for you. And then statins, because vitamin D needs cholesterol to do what it needs to do, and then the statins mess with that. It's just said to design to help reduce your cholesterol, and it does, but it's still questionable how much it actually reduces risk in women from actually having a cardiovascular disease. That's another topic. I'm going to bring an expert in to talk more about that. But statins take away from, it blocks your absorption. What should your levels be? So you're insufficient if you're below 20. Ideally, you would be between 60 and 80. That is when your body is maximally supported. And you would be toxic if you're over 150, which is rare, but it happens. I want you to know. When I say your ideal levels are between 60 and 80, if you go to your doctor and you're at 30 or you're at 40, they'll say you're fine and send you on about your way. And you're not insufficient at that point. But the higher it is, between 60 and 80, your body is maximally supported and you'll just be better off. So I encourage you. When I first personally got wind of what my level should be, I was at a 30, and now right now I'm at 65, and I take 5,000 IUs a day of the D3K2. All right, so we would love to be your vitamin D3K2 and magnesium supplier. You can visit us at here, or also the link will be in the down bar. That is as I said, we focus on women in the pause phase, and we make sure that we have what you need to be successful on this journey. And I think that's all I have to say about that. Oh, no, I have another slide. I just wanted to show you all the picture of the magnesium and the vitamin D. And then lastly, if you're not able to take the D3K2 because you can't take the K, we have an all vegan form of D3, and then a non-vegan form of the D3 without the K2 to make sure that we can cover you no matter your needs. All right, so I think that is truly it this time. Please do, again, like, subscribe, comment, share, and let me know what else you would love to know or what questions you may have. Thank you again. This is Robin-Nutritionist, Necessary Nutrition. Eat well, think well, and be well. Until we meet again, take care.